Well, how do you grapple with a health emergency that you thought was long gone? I'm talking about measles. Today on This is Manitoba, we're going to find out how people in southern Manitoba have been dealing with it. I'm Marcy Markusa. Thanks for joining the podcast. So we have a number of ways we're going to look at this, always through a Manitoba lens on the podcast. And today we're going to be hearing from the mayor of Winkler. That's one of the communities that's been identified as having cases of measles. We'll hear from residents there as well. CBC's Rosanna Hemple traveled to the city of Winkler. We also have a world-renowned expert that we're going to be hearing from. You might know Dr. Peter Hotez's name. He was on Time Magazine's list of the 100 most influential people in global health for 2024 for his work on vaccines. So he visited Manitoba, so we took an opportunity to have a feature interview with him. But let's start with what is happening currently here. Provincial health officials are warning of new sites, as I mentioned, in southern Manitoba where you may have had an exposure to measles. So there was an elementary school in Dougal, there was a Superstore in Winkler, and Boundary Trails Health Centre as well. Rosanna Hemple, as I mentioned, CBC's Rosanna Hemple visited the Superstore in Winkler with that exposure warning, and she spoke with some people that were doing their grocery shopping, residents Henry Wiebe and Adina Hamm.
Have you heard of the exposures in town recently?
Yes, I have.
And how does that make you feel?
It's disappointing. It's disappointing in the fact that, we shouldn't be talking about the measles as far as I'm concerned, but it's unfortunate.
So the last exposure alert that we got was for this location. Did you know about that?
Yes, I did.
And do you feel comfortable going, shopping and everything like that?
Well, I do because our family has been vaccinated, and so we're okay going about the neighborhood.
What have people been talking about? Like, how are people talking about this topic?
Well, I think it's along the lines that we shouldn't be dealing with this type of thing, as I mentioned before, and just the fact that the vaccinations are readily available, and so I hear quite a lot of that.
Okay, so people are talking about the vaccinations. Have you heard about some folks, maybe being interested in doing that?
I haven't talked to anybody specifically about that, but I know that we have family in the medical profession at Boundary Trails, and there's obviously a lot of people that are coming in to get vaccinated. So that's a really good thing to hear.
Anything else you want to share?
Just everybody needs to go out there and get vaccinated. There's no charge. It's a wonderful thing to do, and you're looking after your family. So I wish that everybody would do that.
And do you mind sharing, like, when you got vaccinated yourself? Like, maybe it was as a kid?
It was. When I was little, our whole family was vaccinated then.
Okay. And do you mind me asking, like, vaccination, is that kind of a taboo topic?
It isn't in our family, obviously, with being connected with the medical profession, but I hear a lot, or we hear a lot more of the negative side of vaccination. That's, of course, just my perspective, but that's out there, that sentiment is out there, and I think it's unfortunate because I think there's a lot of misinformation being put out there, and the medical profession does a wonderful job, and when we don't go and look after ourselves, they also bear the brunt of that.
Rising measles cases in the last few months, how do you feel about that?
I'm concerned because there are quite a bit of people around this area that don't vaccinate their kids, and my kids are vaccinated, but I think there's still a risk for my kids, which is a little scary. I'm not sure if adults are supposed to get revaccinated, but just getting measles as an adult is really scary, and any child really. So, and I've heard the cases are climbing quite a bit. I definitely have a concern for measles and the children that are exposed to those people that aren't protected. So.
And have you noticed that people are talking about it in town?
We did get sent a little pamphlet from the school to encourage vaccinations because it is on the rise. So yes, I have seen some concern. But like I said, I live in an area outside of town that is very much unvaccinated.
That was the CBC's Rosanna Hemple talking to residents who are navigating the challenge of measles exposure. That was Henry Wiebe and Adina Hamm. They were outside the Superstore in Winkler. That was one of the sites that was highlighted by the province as an exposure site. Well, the mayor of Winkler is Henry Siemens, and while in that city, Rosanna also spoke with him.
I think right now, from everything that we're seeing, we're really pleased with the communication that the province has getting the news out there so that people know that if they've been at one of those exposure sites that they need to self-monitor and be aware of those kinds of things. That, I think, is the most important part from us, making sure that there's really good, clear communication quickly so that people are aware of what's there and then to be able to self-monitor and pay attention to what's happening.
And have you heard, whether that's been helpful at catching some cases early?
I don't know that we've heard anything along those lines at all. The cases have been quite low, thankfully. But I do know whenever we have a situation of any kind that's health-related, the more information we have, the earlier, the more we stand a greater chance of catching it and making sure that it doesn't spread.
Is there anything else that you feel that public health could be doing that would make it, more comfortable for you on council?
I think overall on council, this isn't something that we're hearing a lot of at all at this point. Right now, Manitoba Health has done a great job of communicating. The school divisions did a terrific job when their announcement came that there had been an exposure at the school. Really good communicating to the public, really good in communicating to the parents that were there. They offered a vaccine clinic as well for those that were interested maybe in being vaccinated against measles if they hadn't been already. So I think what we're seeing so far is a really well-coordinated plan and that everybody is on top of it quickly whenever there's a situation.
And which school was that they had the vaccine clinic at?
And I would direct you back to the school. I know that when we spoke to GVSD, they let us know. And again, as I mentioned, the communication has been really good all the way through, making sure that we're aware of what's happening. Again, healthcare isn't a municipal mandate that falls with the province, and education isn't a municipal mandate. It falls with the school division. But they've been good at keeping us in the loop and letting us know that this has happened, and this is our plan, and this is how we're going to approach it. I think one of the things that we've found is that whenever we communicate quickly and clearly with each other, we stand a greater chance of not catching anybody off guard with something and then being able to know what's happening.
Does the council have a position on, vaccinations or encouraging anything like that?
Absolutely, we do. We believe that everyone should talk to their doctor and then together with their doctor make the best decision for their family.
Okay. Anything else you want to share?
I think the biggest thing that I really want to share is how proud I am of the different organizations and their communication and making sure that those lines are open, making sure that people are aware of if there has been an exposure, making sure that everybody in the community knows about it and that they have an opportunity then to self-monitor to make sure that if, in fact, it also then happens to you, that we're not spreading it further.
I guess, are you concerned that this could, that there could be a lot more cases?
I don't know that I could be concerned in that regard. I think as a community, we want to be careful in all aspects, just like every community should when there has been an exposure. Past that, from what I've seen so far, Manitoba Health has done a great job of communicating those pieces when it has happened, which gives the community the greatest chance at success at making sure we minimize whatever is happening in the community.
Anything else that we can learn, because this might happen to another health region, or anything else that we can?
I think the biggest thing that we should and could and will learn from, are learning from, is that really good, clear communication very quickly is key. And we've seen that so far, and so far that's certainly helped from a very contagious, easily communicable type of disease. The numbers have been quite low, and I believe to a large part that has been because the communication has been so good.
That was the mayor of Winkler, Henry Siemens, in conversation with the CBC's Rosanna Hemple. Well, navigating all of this, obviously, at the local level is one thing, but what about at the global level? We had the opportunity to speak with a world renowned expert on vaccines. His name is Dr. Peter Hotez. You might know his name. As I alluded to at the top of the podcast today, he is an American pediatrician. He's a virologist. He was Time Magazine's 100 most influential people, or one of them rather, in global health. In 2024, he made that list. He was co-nominated for the Nobel Peace Prize for his work on a team that developed a low-cost, patent-free COVID-19 vaccine. He was in Winnipeg recently for a series of talks. He says misinformation and the rise in anti-science rhetoric are, quote unquote, the new normal. And we wanted to talk to him about measles, but also, of course, about his vast knowledge about vaccines, about denial, about vaccine effectiveness, and also about just the state of people's concerns in the world around global health. Here's my conversation with Dr. Peter Hotez.
Oh, thank you for having me.
So how big would you say the anti-science movement is right now? How do you describe this?
Well, certainly in the United States, and unfortunately moving into Canada to some extent, it's become quite a significant anti-public health force. You know, in the U.S., especially where I am in Texas, we've had a lot of people needlessly lose their lives because they refuse COVID vaccines. So, you know, if you look, for instance, at the population of Texas, which is similar to the size of Canada, you know, roughly 30 million plus. In Texas, we lost 100,000 people to COVID. In Texas, it was exactly half that, 50,000 deaths in Canada. Because of in Texas so much vaccine refusal. So of the 100,000 deaths in Texas, almost half did not have to happen, but they were 50,000 needless deaths because people in Texas refused COVID vaccines. And that's how dangerous this movement is. They were targeted not through what's sometimes called misinformation or infodemic, implying it was just random junk out there on the internet, but it was a targeted and deliberate movement. And now in the U.S., especially where I am in Texas, is starting to spill over into childhood immunizations. And we're seeing now a very large measles epidemic in the same places where people needlessly died because they refused COVID vaccines. So a spillover to childhood immunizations.
I wonder, from your obviously your wealth of knowledge, I would love your perspective on this idea that, you know, how much of the movement grew because people at first didn't feel heard during COVID. They might have had vaccine hesitancy. And then they felt that they couldn't even express that. They got labeled, quote unquote, anti-vaxxers, and then maybe felt they were being told what to do instead of being provided information to make their choice. How much of this started there? And how different is that from how it's been co-opted now?
Yeah, it's a very good question. You know, what started as resistance or pushback against vaccine mandates, which you could sort of understand. Unfortunately, the anti-vaccine activists wedged in there and then went the next step and falsely discredited the effectiveness and safety of vaccines. And that's where I got involved because I'm a vaccine scientist and pediatrician, and I'm also the parent of an adult daughter with autism and had written intellectual disabilities and written a book called Vaccines Did Not Cause Rachel's Autism, which came out of my long discussions with Robert F. Kennedy Jr. back in 2017. So the problem was, you know, starting around and with the COVID pandemic was there was pushback against the mandates, and then you started to see things happen, for instance, at the CPAC Conference of Conservatives in Dallas in 2021, where it started out, first they're going to vaccinate you, and then they're going to take away your guns and your Bibles. All right, you get it. It's a bit over the top. And again, that pushback against vaccine mandates. But then what happened was they brought on all of the most toxic anti-vaccine activists to falsely discredit the effectiveness and safety of vaccines. And then this amplified was amplified by some U.S. senators and members of Congress. It was amplified nightly on Fox News during the Delta wave that falsely discredited the effectiveness and safety of vaccines. This is when you got Joe Rogan pushing ivermectin, which does nothing for COVID in place of getting vaccinated. And then in parallel, you started to see this merge or coalesce with the health and wellness and nutritional supplement industry that was buying up things like ivermectin or hydroxychloroquine in bulk and then selling it at a big profit and pairing it with telemedicine visits. So it was really this convergence of the health freedom, libertarian ideologies with the very corrupt health and wellness and influencer industry that was making profit on it. And this is now really accelerated in the rural conservative areas of the country, West Texas, the Panhandle, going up into Oklahoma and Kansas. And to some extent, you're starting to see it in Alberta and possibly in adjoining areas of Canada and moving south. So it's coming up from the South Plains and down from the North Plains.
So, having said that, you've called this the new normal, and obviously, RFK Jr. is now in charge of much of your health decision making in the United States. But just to keep it here in Canada, what we understand about people that just frankly don't trust science anymore, how do you begin to rebuild that trust, or what do you think the next step is when you look at this from a public health point of view?
Yeah, I mean, and so I think you hit on a very important question, and now I'm going to give you a very long, I don't really know the answer to your question answer, because it is so complicated, and we're not reaching the people that we need to. I mean, part of the distrust in science and medicine, the claims are made that it was the scientists who screwed up or the public health experts who screwed up and gave the wrong messages. And I push back on that and say, not really. I mean, the message, as it will always be, imperfect in a pandemic, but the information wasn't that bad. What you had, though, was the people coming out of the far right with the health and wellness movement that was actively seeking to discredit the science and the scientists and the public health professionals, trying to portray them as cartoon villains or public enemies. And ultimately, that's what really did the damage. So the idea that people don't trust scientists coming out of the blue, no, it was due to an active movement seeking to discredit the science, the scientists, the public health, and the public health experts.
Obviously, with the province dealing with the rise in measles cases, and right now, in the moment we're speaking, it's in southern Manitoba mostly, health officials are saying that some of the recent measles cases did not have any known contact to an infected person. I'm switching gears a bit here on us, but how concerning is that?
Well, measles is one of the most highly contagious viruses we know about, maybe the most single contagious virus. So it's actually a good indication of how robust your vaccination program is, because the minute you start to see declines in childhood immunization rates below 90%, measles won't be the last one you see, but it's usually the first one that you see. So it's a good indicator that things are not going as well as you'd like. And that's what we're seeing now in the Southern Plains and in West Texas, moving up into the Panhandle and Oklahoma. And I do worry that a similar movement could be underway in Alberta and possibly neighboring Manitoba, which is one of the reasons that I'm here to see, what we can do to get out really important health information on both the safety of the MMR vaccines, which is the measles, mumps, rubella vaccine, one of the safest vaccines that we know about, one of the most effective vaccines that we know about, and to also debunk this idea that you can compensate for not getting vaccinated with this phony baloney cocktail of budesonide and vitamin A and clarithromycin, which is the kinds of things, tragically, our Health and Human Services Secretary has been talking about.
Is there anything that you think that a government can do to convince, for example, someone who is hesitant to vaccinate themselves and their family, without isolating or shaming someone, without forcing someone to do it, and maybe strengthening their resolve, not to do it? Like it's kind of a repeat of where do we go from here question.
Yeah, exactly. Yeah, you're absolutely right. There are some things, and I've put this out in an article in the Public Library of Science on some of the simpler things that we can do. One is I've created some infographics that look at what happens if lots of children get measles where you have 20% hospitalized, a high percentage of measles, pneumonia, even death, ICU admissions, permanent neurologic damage, versus the very rare side effects of the MMR vaccine, the measles, mumps, rubella vaccine. And those infographics are useful because one of the tactics of the anti-vaccine activists is they tend to downplay the severity of measles or other childhood infections and to tend to exaggerate the very, very rare side effects of the MMR vaccine. So I think that's very helpful. The other is to actually debunk the specific disinformation talking points from the anti-vaccine movement. And that's very helpful for healthcare professionals also, because sometimes parents are downloading this information and the pediatrician or the family practitioner or internist or nurse practitioner says, well, gee, I never heard that before, and is made to feel like they're not keeping up with the literature. Well, they are, but they're not keeping up with the fake stuff. So, for instance, we had the Florida Surgeon General, Dr. Latipo, who's who's an anti-vaccine activist, make public statements that the COVID mRNA vaccines are causing turbo cancer because the nucleic acid is integrating into our genome next to oncogenes. And so I would then go on the cable news channels and say, wait a minute, there's no such thing as a turbo cancer. That's a made up term. And what's more, the lipid nanoparticles that deliver mRNA and nucleic acid get past the cell membrane into the cytoplasm, but never get into the nucleus. And even if they were, we have proteins of our innate immune system that prevent the incorporation of foreign nucleic acid into our genome. Otherwise, every time we ate a hamburger, we'd have cow DNA integrating into our nucleus. And then people will get that. But we need to have that more readily accessible for healthcare providers, and of course it keeps switching up and changes. Just as soon as you think you've gotten on top of it, it's a bit like playing whack-a-mole or moving the goalpost. The anti-vaccine activists come up with something else. So it's that website has to be updated in real time. So I think those kinds of things are relatively straightforward to do, and it's at least a first step in trying to restore vaccine confidence.
Obviously, the rhetoric can become dangerous. You in your own life and experience have experienced aggression as a result of the rhetoric. Can you share with the listeners sort of some of the things that you've been through because of trying to stay out front of the truth of science here?
Yeah, I mean, one of the activities of the anti-vaccine activists, especially the health and wellness influencer groups, because I'm bad for business. So what they'll do is they'll try to portray me as a public enemy or a cartoon villain and put it out there on social media, either through Twitter or X or other social media platforms, or I'll get threatening emails. I'll get stalked where where it's been announced I'm giving a public lecture. And there's other dark components to it as well. As I say, sometimes I'm the trifecta. I'm a scientist, a vaccine scientist, and a Jewish vaccine scientist. So it gets into these ancient tropes of anti-Semitic tropes claiming that Jews start pandemics or profiting from vaccines. So unfortunately, we've had swastikas mailed to our home on a couple of occasions. And so there's that dark element as well. So it's not for the faint of heart. It's pretty tough, but it's also important. I've devoted my life to making low-cost vaccines for the world. 100 million doses of our vaccines have been administered, showing that it's possible to bypass the big pharma companies to get vaccines out there for people who need them. But now this has become, I realize, maybe almost as important in terms of saving lives as countering the very aggressive anti-vaccine activism.
Are you still hopeful that we're going to, for the world's view on vaccines, as we're talking about this complicated way that misinformation and lies and targeting things, and I mean, I'm just asking that because there's people still in their Facebook threads that are just disengaging. That seems to be the solution, where it's like, well, I can no longer, people are just disengaging from each other. It's just making the echo chambers stronger. Even where, we need to have conversation about this. Are you still hopeful that we're going to go to a better place with this?
Well, I always remain hopeful, and, optimism is important, but these are dark times, especially in the U.S., where the anti-vaxxer in chief is also now the the Secretary of Health and Human Services, and every few days he comes out in a very public way with some zinger that completely goes against what the science says, and then I'm out there debunking it. But I think your second part of your question gets to a very important point: is it's reaching those individuals who are walled off from the information. For instance, the point I was making about debunking the Florida Surgeon General and what he was saying about turbo cancers and mRNA vaccines. I mean, I can go on CBC or CNN or MSNBC and detail the evidence, the why it's absurd, but it's not always reaching the people who are watching Fox News and Joe Rogan podcasts and who are being inundated with disinformation. And that's, I think, one of the big challenges is, North America now, we're seeing kind of two separate societies arise, and reaching those individuals is really complicated, as evidenced by this horrific measles epidemic that's now taken the lives of two otherwise healthy kids in West Texas and now in the Panhandle.
And just as a last question to follow up to measles, the case that I mentioned, that the health officials saying cases didn't have any known contact to an infected person, is it known that measles can spread that way, or is this an unusual moment?
Yeah, good question. One of the reasons why measles is so highly contagious is the virus is very hardy and can remain suspended on microparticles in the air sometimes for a couple of hours. So you could be at an event, let's say, where someone with measles had been a couple of hours earlier, and even though you're not in direct contact with that individual, the virus can still linger, and that's where we can start to see it. If you're not vaccinated, or if you're an infant not yet old enough to receive the MMR vaccine, that's where the problem is. So when people talk about health freedom, medical freedom, often I say, what about the health freedom of a parent who is fearful of bringing their young infant out and about in a place of shopping or a restaurant because they're worried about their baby catching measles, and we have to consider that as well.
Dr. Peter Hotez, a pleasure to have you with us on CBC and in Winnipeg. Thank you very much for your time.
Thank you.
That is Dr. Peter Hotez, a world-renowned American pediatrician and virologist. He's also the author of The Deadly Rise in Anti-Science, A Scientist's Warning. My name is Marcy Markusa. If this is your first time with us on This is Manitoba, thanks for being here. And don't forget to like, subscribe, and share.